I am both in awe and grateful that we have a vaccine to prevent COVID-19. This is a remarkable accomplishment, and it demonstrates that we can work together. Some people have likened this, not my words, to the lunar landing of vaccinology. We now have data in over 70,000 patients on these first vaccines that it's safe and effective. I trust the science, I trust the process, and when it's my turn, I am absolutely getting the vaccine.
If we all get vaccinated, our work will be a much safer place, where we can focus on the health of our patients, knowing that our own health and safety is no longer in jeopardy.
Without hesitation, I will be getting a COVID vaccine because I trust in the science, and I know that vaccines work, and I know that they're safe, much safer than the diseases that they're designed to prevent.
Prevention is better than cure. The reason why I'm getting this vaccine is to protect myself, to protect my family, my friends, my co-workers, my community, my patients, and help stop the spread of this pandemic.
I've witnessed the devastation caused by COVID firsthand and cried with staff and families as a result. I've seen enough. On average, I interact with 50 people a day and eventually go home to my own family. I don't want this infection, and I don't want anyone I love or serve to be at risk of getting this from me, even if inadvertently, as I'm serving others.
After a long and exhausting week of taking care of COVID patients, I realized that the only way we're going to get past this pandemic is to get vaccinated. That's why I'm getting vaccinated. It's really the best thing that I can do for myself, my patients, my coworkers, my family and friends. Let's get vaccinated. Let's do this together.
I had several family members that contracted the virus. Some have risk factors for serious complications. One family member spent 2 weeks in the ICU, and another one died as a result of COVID. So I see this as my opportunity to help protect my family and to help protect my community.
I'll be getting it so I can actually start being the front line and try to help prevent people from getting sick rather than just take care of them when it's already too late.
As a pediatrician, I'm getting it so that I can share smiles with my patients, so that teachers and students can return to school safely, and so that families can seek medical care without fear of infection.
One reason is because my mother, Shinobu Galloway, who works at the University of Nebraska, Omaha, is one of the people who is working with the vaccine. And once my mom tells me that it's good to go, then I'm going to take it. And I know my mother would never tell me to take something that's going to harm me.
I truly believe in the value of vaccinations, and I have tremendous respect for the science behind them. So I will be getting my COVID-19 vaccination.
I'm going to get the vaccine because the science that was used to develop it was sound. The evidence shows that it's safe to take and it's effective at what it does. And I want to do my part to keep my patients and them safe.
Because I've seen too many people, both young and old, get sick already from this virus. Because I've watched so many Hennepin employees giving everything they've got just to keep this virus at bay. Because every day I prescribe medications, from blood pressure pills to antibiotics, that have been studied in the same way this vaccine has for safety and effectiveness. But most of all, because I care about you, and I really hope you care about me too.
I'm taking the vaccine for other people, adults who are immunocompromised, pregnant women, children, those who can't receive the vaccine early. They're counting on us to keep them safe.
Number one, our staff have reviewed the data and they trust it. Number two, I trust the science behind vaccine technology. And number three, we've been reacting to this virus for almost a year, and this vaccine gives us a scientifically proven way to be proactive in getting our lives back and protecting the health of our patients, our families, and our community.
When I think about if I get vaccinated, it's because I trust the vaccine more than I trust the virus itself.
I think it's safe. I've looked at a lot of the data. I also have seen so much tragedy, sadness, illness, death, and I think we want to prevent that. That's why we're here. We want to keep people well. We want to keep ourselves well. And lastly, for personal reasons, I would love to get back to normal life. I want to see my family more. I've been restricted from them on purpose, to keep them safe and away from me, who's been working here at the hospital.
Y voy a coger mi vacuna de COVID para mantener a mi familia y amigos saludables.
Because I want us all to be able to see each other's faces, smile at each other again, keep providing awesome care to our patients, knowing that we're protected and they are protected. And I also want to be able to see my extended family and get back to that old normal. I really miss that old normal.
I'm getting the COVID-19 vaccine because, like many of you, I have seen how this virus can ravage not only our bodies, but our minds, our hearts, our spirits, and even our whole communities. But I trust the science. I trust that this vaccine is safe. I trust that it is effective, and I know that it is safer than getting COVID-19. In this hard time of this pandemic, I can't think of anything that will bring us together as a human family more than the simple act of getting a vaccine.
I am getting the vaccine for the safety of the patients I take care of and for my family, especially for my children, so they can continue going to school and so that I can see my extended family.
Because I want to do my part to help end this pandemic. And I would also really, really like to see my family, and this is step one.
Getting vaccinated is the best gift I can give this year to those who I care about, which, it turns out, happens to be all of you.
We need our entire community to feel safe and confident in this vaccine. And so I want to show my patients, my friends and family, those who may be vulnerable and those who may be skeptical, that this vaccine has gone through a process. It is safe, it is effective, and I'm honored to be able to lead by example.
I am driven by data, and the data has shown that the vaccine is safe, it works, and it is highly effective.
When my phase comes to receive vaccine, I will be in line to receive it. I'm doing this to stay strong. Stay strong for our patients, for our staff, for my family, and for our communities. Plus, I'm looking forward to seeing everyone's smiley face. Thank you.
It truly is a shot at hope.